Hi, Mr. Giddens. My name's Cory. I'm a PA student. I'm going to be doing your physical exam today. So I'll wash my hands and then we'll start.
Okay.
So I am observing patient's general state of health, height, build, level of sexual development, and observing his posture, motor activity, dress, grooming, hygiene, odors, body, and breath. I'm assessing orientation to person, place, time, and situation. So at this point, I'm going to get the vital signs. So I would get height and weight, and we will forego that. And we get the temperature, and we'll skip that. Now I'm going to get the respiratory and heart rate, the radial pulse. I'm going to get each of those for 1 minute each, keeping my hand on the patient's back the entire time. Okay, so we'll call that 2 minutes. Now I'm going to get blood pressure. So first I'm going to make sure my patient's feet are flat on the floor. You can put your feet flat on there, please. Palpate the brachial artery for proper cuff placement. And I'm going to palpate the radial artery to avoid an auscultatory gap. I'm going to get the blood pressure. Okay, and I would get the blood pressure in both arms. Okay, I'm going to move on to head and face. So I'm inspecting the head, the face, and scalp. I'm going to palpate the skull, scalp, hair, and face. I'm going to part the hair as I inspect it. I'm going to palpate the TMJs bilaterally just in front of the tragus. If you could open your mouth, please, and close it. Good. I'm going to assess granular 5 motor by palpating the temporalis and masseter muscles. You can clench your teeth, please. Okay, good. Now I'm going to move on to the eye exam. So first I'm going to inspect, first I'm going to ask, do you wear glasses?
No.
Okay, I'm going to inspect the eyes for symmetry. Inspect the eyebrows, eyelashes, eyelids, the lacrimal glands, conjunctiva, sclera, and cornea. Okay. And I'm going to test visual acuity. I would test with and without glasses if you wore glasses. So if you could hold this at about 14 inches. And with both eyes, if you could just read this line from left to right, please.
583279.
Okay, good. And then close or cover your left eye. And then read that same line from right to left.
583279.
Okay, and then cover your right eye. And read the same line from left to right.
972385.
Good. Then I'm going to palpate the eyes. I'm going to palpate the eyebrows. You can close your eyes, please. Globes and the lacrimal ducts. Okay, good. I'm going to test extraocular movements, cranial nerves 3, 4, and 6. So slide. And I want you to just follow my finger with your eyes without moving your head. I'll test for lid lag. Okay, good. Now I'm going to test for convergence, constriction, and accommodation, cranulars 3 and 4. So if you could just look at the center of that clock, and then when I tell you to, focus in on my fingertip. Okay? Good. Now I'm going to test visual fields by confrontation. So if you could cover your right eye, please, and just tell me when you see my fingers come into your field of view.
Okay. 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 Okay.
Okay, keep that same eye covered.
Okay. 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 Okay.
Okay, and if you could cover your other eye, please. And same thing.
Okay. 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 Okay.
Okay, keep that same eye.
Okay. 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 Okay.
Okay, good. Now I'm going to do the cover-uncover test. So just look straight over my shoulder. Okay. Good. At this point, I'm going to dim the lights. And I'm going to test pupillary constriction, or pupillary reaction to light, both direct and consensual. Sorry, cranular 3. Okay, direct, consensual, direct, consensual. Okay, now I'm going to use my ophthalmoscope to do the fundoscopic exam, assessing cranial nerve 2. So if you could just look straight over my shoulder at those cabinets. Good. Turn the lights back on. Okay, then we move on to the ears. So the first thing I'm going to do is inspect the external appearance of the ears. I'm going to palpate the entire auricle, tragus, mastoid process. I'm going to tug up and out on the ears, testing for external auditory canal inflammation. Does that hurt?
No.
Does that hurt?
No.
Okay, now I'm going to inspect the ears using the otoscope. I'm going to inspect the tympanic membranes, the ear canals, and the ossicles. Okay. Okay. Now I'm going to assess gross hearing, cranial nerve 8. So if you could cover your right ear, please. And just repeat the word that you hear me whisper.
Baseball.
Okay, now cover your other ear, your left ear, and then repeat the word you hear me say.
Football.
Good. Then I will do the Weber test. So just tell me if you hear this equally in both ears, more in the left ear or more in the right ear.
Equally in both ears.
Okay. Then I'm going to do the Rene test bilaterally. So just tell me when this sound stops.
Okay.
Can you still hear it?
Mhm.
Okay. And tell me when the sound stops.
Okay.
Can you still hear it?
Mhm.
Okay. Then we move on to the nose, so I'm going to inspect the external appearance of the nose. I'm going to inspect the frontal and maxillary sinus areas. I'm going to palpate the frontal and maxillary sinus areas. I'm going to palpate the external nose for tenderness and crepitation. I'm going to inspect using the otoscope again for, I'm going to inspect the turbinates, nasal mucosa, and nasal septum. You dip your head back a little bit. Good. I'm going to test for nasal patency bilaterally. So if you could occlude one nostril for me, just take a big sniff. Okay, then the other side, sniff. Okay, good. Now I'm going to assess cranial nerve 1 using the smell test. So if you could close your eyes, please, and occlude one nostril for me, and then just tell me what you smell.
Mint.
Okay. Close your other nostril, and tell me what this smells like.
Coffee.
Okay, good. Now I'll move on to the oropharynx. So first I'll ask, you wear dentures?
No.
Okay. Now I'm going to inspect the oropharynx. I'm going to inspect the lips, teeth, buccal mucosa, gingiva, sublingual region, tonsillar pillars, tonsils, the posterior pharyngeal wall. Okay. So go ahead and open your mouth, please. Okay, adjust the tip of your tongue to the roof of your mouth. Stick your tongue out and say ah.
Ah.
Okay, stick your tongue out and move it side to side. Okay, so the uvula and the soft palate rise, that's cranial nerves 9 and 10. I would test the gag reflex this time, that's also cranial nerves 9 and 10. And the tongue protrusion moving side to side is cranial nerve 12. Okay, move on to the neck. So first I'm going to inspect the anterior appearance of the neck, offer you a sip of water, and have you swallow. Okay, now we'll test the active range of motion at the neck. So just follow after me, we'll do flexion, extension, lateral flexion, rotation, and rotation. Okay, good. Now I'm going to test cranial nerve 11. I'm going to test muscular strength against resistance of the sternocleidomastoid and trapezius muscles. So just press up on my hands. Okay, press it to the side. Press to the side. Okay, good. Now I'm going to palpate lymph nodes. So I'm going to palpate preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervical. Shrug your shoulders forward just a little bit. Supraclavicular, and axillary lymph nodes. Put your arm down. Put your arm down. Okay. Now I'm going to assess the trachea, make sure it's midline, the suprasternal notch. Okay, good. Next I'm going to palpate your thyroid. So you still have some water?
Mhm.
Okay. So I want you to just look down at this knee, take a sip of water, hold it in your mouth. Okay, go ahead and swallow. Good. And take another little sip of water. Down at that knee. Go ahead and swallow. Okay, good. All right. Now let's move on to the posterior chest. So you could turn and face your back towards me. So first I'm going to expose the area to be examined so I can see the landmarks. All right, I'm inspecting for symmetry, skin characteristics, and configuration. I'm inspecting rate, rhythm, and shape. And I'm going to palpate the posterior chest. I'm going to assess chest excursion on deep inspiration. Go ahead and take a deep breath in for me. And let it out. Okay, good. If you could just hug your arms in front of you and kind of bend your back a little bit. I'm going to assess vocal fremitus in the apices, posterior, and lateral lung fields. Every time you feel my hands touch your back, just say 99.
99, 99, 99, 99, 99, 99.
Okay, good. I'm going to percuss the posterior chest, the apices, posterior, and lateral lung fields. Now I'm going to assess diaphragmatic excursion. So, just breathe normally for a second. We'll do the right side first. And just cross your arms in front of you again. Now I want you to take a deep breath in as hard as you can and hold it. Okay, go ahead and breathe. Okay, now I want you to take a deep breath in as hard as you can and then blow it completely out. Go ahead and breathe. Okay, and I would assess that on both sides bilaterally. Okay, now I'm going to move on to auscultation. So I'm going to auscultate the apices, posterior, and lateral lung fields. Every time you feel my stethoscope touch you, just breathe all the way in and all the way out through your mouth, and I'm going to listen through an entire respiratory cycle. Good. All right, then we'll move on to the anterior chest. So if you could just face this way. All right, so first I'm going to expose the area to be examined so I can see the landmarks. I'm inspecting for symmetry, skin characteristics, configuration. I'm inspecting rate, rhythm, and shape. Next I'm going to palpate the anterior chest. I'm going to assess vocal fremitus in the anterior chest and the apices and anterior lung field. So every time you feel my hands touch you, just say 99.
99, 99, 99, 99, 99.
Okay. Then I'm going to auscultate the anterior chest. I'm going to auscultate the apices, anterior, and lateral lung fields. Every time you feel my stethoscope touch you, just breathe in and out through your mouth, and I'll listen through an entire respiratory cycle. Now I'll move on to the cardiac exam. So I'll just listen to your heart sounds while you're in this position. I'm going to listen with the bell and the diaphragm of my stethoscope. The aortic, pulmonic, herbs, tricuspid, the mitral. Okay, then with the diaphragm, the aortic, pulmonic, herbs, tricuspid, mitral. Now we'll lay the patient back to 30 to 45 degrees. Oops, what's that water cup? Go ahead and lay that. My sheet at this point. Okay, first I'm going to inspect the precordium, the neck veins and carotid pulsations. I'm going to palpate the point of maximal impulse. Okay, I'm going to use the palmar surface of my hands to palpate the precordium, checking for heaves or thrills. Okay, I'm going to palpate the carotid arteries bilaterally, one at a time. Next, I'm going to palpate the suprasternal notch for pulsations. Then I'm going to auscultate the carotid arteries bilaterally, so if you could just turn your head and hold my breath while I listen. Okay, take a breath. All right, hold your breath while I listen. Okay. Now I'm going to listen to hard sounds again with the bell and the diaphragm of my stethoscope. Aortic, pulmonic, herbs, tricuspid, mitral. And with the diaphragm, aortic, pulmonic, herbs, tricuspid, mitral. Okay, then we'll move on to the abdominal exam. So you can put this back over your shoulders. Properly position and drape my patient. So watch out for the fall. Okay, knees up. Okay, first I'm going to inspect the abdomen for skin changes, contours, and pulsations. Next I'm going to auscultate. Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. I'm going to auscultate the abdominal aorta. Left renal. Right renal. Right iliac. Left iliac. Left femoral. And right femoral. Okay. Then I'm going to percuss. I'm going to percuss the abdomen in general. I'm going to percuss the spleen. I'm going to percuss the gastric air bubble. I'm going to percuss the bladder. And I'm going to percuss the upper and lower borders of the liver. Okay, just move this a little bit. Okay. Then I'm going to palpate. I'm going to lightly palpate all four quadrants. I'm going to deeply palpate the abdomen in general. Okay, I'm going to palpate the abdominal aorta. Okay, I'm going to palpate the spleen. So if you could take a deep breath in, please, and blow it all the way out. Okay, I'm going to palpate the liver. So if you could take a deep breath in, please, and let it all the way out. Okay, good. Then I'm going to palpate the inguinal lymph nodes, both on the left, or on the right, and on the left, and femoral pulses on the left and the right. Okay, good. Now we'll move on to extremities. So you can put your gown back down, move the sheet, and you can sit back up. So I'll inspect the upper extremities first. I'm inspecting the fingers, fingernails, palms, and both arms and shoulders. Okay, I'm going to palpate the fingers, the DIPs, PIPs and the MCPs. Okay, I'm going to palpate the wrists, muscle groups of the lower arm, elbows, muscle groups of the upper arm, and the shoulders, including the acromioclavicular and sternoclavicular joints. Okay, and way back down, I'm going to palpate brachial arteries, radial arteries, and epitrochlear lymph nodes. Okay, then we'll do active range of motion of the upper extremity. So just follow after me. We'll do the fingers, flexion, extension, abduction, adduction. Okay, and then we'll do muscle strength against resistance of the fingers. So stabilize the joint and do flexion, extension, okay, flexion, extension. Okay, spread your fingers apart. Don't let me press them together. Okay, make the OK sign. So we'll test opposition. So just don't let me pull your fingers apart, and we'll do each finger. Okay, and we'll test grip strength. Go ahead and squeeze my fingers. Okay, then we'll test active range of motion at the wrists. So hold your hands up and then go flexion, extension, ulnar deviation, radial deviation. And we'll do muscle strength at the wrist. So we'll do flexion, extension, and flexion, extension. Okay. Then we'll do active range of motion at the elbows. So follow after me. We'll do flexion, extension, supination, well, pronation, supination. Okay. And then we'll do muscle strength against resistance at the elbow. So we'll do extension and flexion. Oops, flexion. And extension and flexion. Okay, and we'll do active range of motion at the shoulder. So we'll do flexion, extension, adduction, abduction, internal rotation, external rotation. So we'll do muscle strength against resistance at the shoulder. So just press against my hand. We'll do abduction, adduction, flexion, extension. And the same thing on this side. We'll do abduction, adduction, flexion, and extension. Okay. Then we'll move on to lower extremities. So I'm inspecting the toes, toenails, feet, both ankles and legs. I'm going to palpate the toes, the metatarsal heads, the feet, the ankles, muscle groups of the lower leg, knees, muscle groups of the upper leg. On the way back down, I'm going to palpate popliteal arteries. Posterior tibial pulses, dorsalis pedis pulses, and I'm going to palpate the pretibial area for pitting edema. Then we'll do active range of motion of the lower extremities. So we'll do flexion at the toes. So like put your toes down, extend your toes up. Okay, we'll do muscle strength of the toes against resistance. So flexion, extension, flexion, extension. Okay, we'll do the ankles. So we'll do plantar flexion like this, dorsiflexion, inversion, and eversion. Okay, then muscle strength at the ankles. So plantar flexion, dorsiflexion, plantar flexion, dorsiflexion. Okay. Then we'll do active range of motion at the knees. So we'll do extension and flexion. Then muscle strength at the knees against resistance. So we'll do extension, flexion, and extension, flexion. Okay, so go ahead and you can lay back again. We'll move on to the hip. So I'll stabilize the opposite side. And we'll do active range of motion at the hip with the right leg. So just lift this leg straight towards the ceiling, that's flexion. Across that way is a deduction, out towards me, a abduction. Lift this knee up towards your chest. Now move it across your body for internal rotation, and towards me for external rotation. Okay, lay it back down. And same with this leg. Up towards the ceiling, flexion, across towards me, a deduction, away towards that wall, a deduction. Bring your knee up, knee towards me, internal rotation, knee away from me, external rotation. Go ahead and lay it back down. Now we'll do muscle strength at the hip against resistance. Go ahead and flex this leg against resistance. Okay, take it across your body, a deduction. Out towards me, a deduction. Okay, same thing on the other side. Okay, flex up, a deduct out, a deduct towards me. Okay, now go ahead and turn over to a prone position. And we'll do extension at the hip. So stabilize this side, and we'll do active range of motion first. So lift this leg towards the ceiling. Extension, set it back down, other leg. Extension, okay. Now extension at the hip against resistance. So press against my hand. Okay. Press against my hand. All right. Go ahead and stand up on the floor. And move on to the back. So just turn it around. And I'll inspect the skin and the spine. And just lean forward just a little bit, arch your back, and then I'll palpate the vertebrae, the cervical, thoracic, and lumbosacral spine. Okay, I'm going to percuss the costovertebral angles. Okay, then we'll do active range of motion with the spine, so I'm going to stabilize the hips. So go ahead and flex forward, extend back, do a lateral flexion to the side, lateral flexion to the other side, and then rotate your shoulders around and look at me, and rotate the other way and look at me. Okay. All right, you can go ahead and have a seat back there. So for the cranial nerves, the neurological exam, I assessed cranial nerve 1, olfactory with the smell test. I assessed cranial nerve 2, the optic nerve, with visual acuity, the fundoscopic exam, and visual fields by confrontation. I assessed cranial nerves 3, 4, and 6 with convergence and constriction, pupillary reaction to light, and elevation of the upper eyelid. I assessed cranial nerve 5 motor with the clenching of the jaw. I'm going to assess cranial nerve 5 sensory with the sharp dull test and the soft touch test. I said cranial nerve 7, we can assess that now. So go ahead and elevate your eyebrows, close your eyes tight. Okay, smile, frown. Okay, and puff out your cheeks. Okay, good. Cranial nerve 8, I will assess balance with the Romberg test, and I assessed gross hearing with the whisper test. Cranial nerves 9 and 10, I assessed with gag reflex, and that the uvula and soft palate were midline, and I would also assess for hoarseness. Cranial nerve 11, I assessed muscle strength of the sternocleidomastoid and trapezius muscles, and cranial nerve 12, I assessed with tongue protrusion. Okay, so now we'll go ahead and assess gait. So if you could stand back up, please. And just walk from here to the door normally. Okay, then turn around and walk back on your toes. Okay, then turn around and walk back on your heels. And then then turn around and walk heel to toe. Okay, good. Have a seat back up here. Okay, then we'll test rapid alternating movements. So start with your hands on your knees, and then just flip them back and forth as fast as you can. Okay. Then of the feet, just tap my hands as fast as you can. Okay, good. Then we'll do finger to nose. So put your finger on your nose. And I want you to reach out, touch my finger, and go back to your nose. And just keep doing that. Okay, and the other hand. Okay, good. And then we'll do heel to shin. So I want you to just take the heel of your one foot and rub it down the shin of your other leg. And the other side. Okay, good. Then we'll do, okay, now we'll do the Romberg test for balance. So you can stand up on your feet and just put your feet together, all the way together, and then close your eyes and just try to maintain your balance. Okay, good. You know, seat back up there. Soft touch. So, I'm going to touch this against your skin. I just want you to say okay when you can feel it.
Okay.
You go ahead and close your eyes.
Okay. 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 Okay.
All right. And then we'll do the sharp bell test. Okay, so this will be sharp, and this will be dull. So just close your eyes again, and just tell me if this is sharp or dull when it touches you.
Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp. 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 Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Okay. All right, and then we will do proprioception. So just close your eyes again. And I'll hold your thumb by the side, and I just want you to tell me if your thumb is up or down.
Down. Up. Down.
Okay, this side.
Down. Up. Down.
And your toes. Keep your eyes closed and tell me if your toe is up or down.
Down. Up. Down. Down. Up. Down.
Okay? And then we'll test vibration. So just close your eyes again and tell me if you can feel this.
Yes.
Tell me if you can feel this.
Yes.
When does it stop?
Stop.
Okay. Tell me if you can feel this.
Yep.
And tell me if you can feel this.
Yep.
Then we'll move on to reflexes. So we'll do the brachioradialis first. Spinal nerves C5 and 6. Okay. Biceps, also C5 and 6. triceps, C6 through 8. Go ahead, relax. Your radialis, 5 and 6. Biceps, 5 and 6. Triceps, 6 through 8. All right, the patellar tendon, L2 through 4. The Achilles tendon, L4, L5, S1, S2. Okay, and the plantar, L4, L5, S1, S2. Okay. Then we'll do stereonosis. So just close your eyes and hold out your left hand, and just tell me what this object is.
It's a letter.
Yes. Okay, keep your eyes closed, and tell me what this is.
Dice.
This. Okay. And don't think I missed anything. This completes my physical exam.